Yes, I heard about you guys through social media. For some reason, I was just scrolling through my Instagram feed, and Barefoot Rehab came up. I looked into adhesion removal, and I decided to give it a shot. Having some really bad pains in my back as well as my legs for years now. Went for hernia surgery to try to see if that would alleviate the pain in my lower back. Also had a couple of torn ligaments in my foot due to a soccer injury.
So Leo actually came in initially with a complaint in his low back and pelvic region. So we actually started off by seeing Dr. Chris.
Our friend Leo, he's a great dude. He came in here with various pelvic and groin stuff. The front of his hip, his groin, his IT band, multiple issues he was having for a couple of years. 2 years prior, he actually had an injection into his pubic bone and made the symptoms go away for a long time, and then he came back in the office.
Right before I was about to go and schedule a session for pain injections again, that was the only thing that had given me some relief for a couple of weeks. I found the Barefoot Rehab on Instagram, and I decided to reach out to them, and thank God I was able to see them, because they really were able to save my life practically. I was just miserable, depressed, not being able to do my regular work, coaching and teaching, a phys ed teacher as well. So back to 100% and very pleased.
When we were doing the history and the exam of Leo's case, we looked at his MRI report, and it said that he had a degenerative spondylolysis. It essentially means that his L5 vertebra, which is shaped like this, here's the vertebral body, and here's the spinal column where the spinal canal holds the spinal cord, it was broken like that and shifted a little bit.
He expressed to Chris that he was having some pain in his big toe, also having some symptoms under the arch of his right foot that he wanted to have taken care of. Leo's a soccer player. He loves being active and being out, moving around. So this was obviously a concern from him, because obviously in soccer, you're using your feet the entire time.
Specific injury, one was on my foot, torn ligaments. I kicked someone by mistake coming in on a challenge on a soccer ball. The other one was, I think, just a repetitive movement on the inside of like my groin towards the back of my hamstring area. Very painful. What the doctors believed were hernias I had developed, but like I said, after the surgery I was still in pain and still on pain medication, and the only thing that provided some relief was some injections I had received to my pubic bone.
So we diagnosed him with a disc issue and degenerative spondylolysis that was causing what's called referred pain into the front of his hip, into his groin, and into his IT band. And he had multiple adhesions in multiple places, but we said that it was likely treating his low back that would result in relief in all three of those spots. Very quickly, after 1 or 2 treatments, he was like, I don't know what you did, Chris, but I'm 100% better. Results are atypical. Most often our average case is 12 visits to get somebody to that good relief, but he responded extremely well.
Oh yeah, I definitely was pretty skeptical, actually. The whole idea, and I figured just hands-on work onto my body can't be better than medicine. Like I said, blown away by the results, and I'm so happy I made the choice to call in and schedule a consultation.
This is the power and the value of a good and proper and correct diagnosis, is when you diagnose somebody correctly, whatever is going on, you treat the cause of the problem and the symptoms will get better.
So we set him up for a consultation examination with me. We kind of unpacked everything that was going on, and we really began focusing treatment on addressing the tissues, not only in the foot, but also in the calf as well. During the exam, we found out that he had limited ankle range of motion. So it was really important that we got that range of motion to improve by addressing the tissues in the calf that limit that motion. Reason being is that when you have limited ankle range of motion, it can actually cause the foot to become overloaded, which was contributing to the symptoms in his big toe as well as in the arch of his foot.
Well, it was just repetitive pain, whether I was moving or just doing any type of stationary work. Sitting down, laying down was painful. At work, going up steps, down steps. It really got to the point where it just became just a whole depressive state where I didn't even want to participate in what I loved, physical education. Didn't want to work out, didn't want to exercise because I knew I would relate that to pain. I've been in treatment with Dr. Chris and Dr. Jeff now since the end of last year, the end of 2019. And I immediately noticed results literally after my first visit. A lot less pain with the plantar fasciitis issue I was having, less pain in my toe, and literally about 70 to 80% better in my lower back right after my first treatment. So happy that Leo responded. He's super happy that we got him results so quickly. Since then, because he does have degenerative arthritis in his low back, we do maintain him there, and he's been symptom-free pretty much for about 8 or 9 months.
So going through treatment, Leo responded really, really well. He got a lot of benefit from treatment, and his symptoms improved fairly rapidly, actually, which was awesome to see. Last time he came in, he was holding at 99% improvement overall and really had not had any symptoms in a handful of weeks. He's back playing soccer, he's back doing the things that he loves doing, and I couldn't be happier with how much improvement he's gotten.
Oh, feeling great. I'm optimistic about being able to continue to improve my body, and the older I get, I thought I'd have to slow down, but I'm actually back at exercising, playing some soccer regularly, and just overall optimistic with life and happy that I was able to make that choice and reach out to these guys.
He was a great patient. He was due diligent. He was on time for all his appointments. He asked great questions, and he really not only took ownership of wanting to get better, but he also was a really great partner to work with in helping him get healthier.
I think anybody with some type of chronic pain, someone that's tried everything else, medicine, injections, any type of therapy, chiropractic work. I mean, I tried it all. Like I said, I wouldn't feel any type of relief. And literally after 1-2 sessions with Dr. Chris and Dr. Jeff, I felt great. Shocked, to be honest. So I would recommend it to anyone who's going through some type of pain. I've even recommended it to a couple of family members as well as friends here at the club where I coach at. After our first consultation had given me a certain number of the amount of pain relief they'd be able to give me, and luckily maybe it was just my experience, but luckily they far exceeded what they offered. So I'm very happy with the way they've treated me.